Continuous glucose monitoring is revolutionizing the way we look at diabetes. We've gone from a 30,000-foot view in diabetes to an individualized, patient-centric glucose or diabetes-related journey. There's been much to talk about regarding the utility, the science behind it. But one of the things that I'm passionate about is going from knowing CGM to actually doing CGM in clinical practice. And what we see in between is this large therapeutic inertia barrier. And so one of the things I want to provide my colleagues, equip those that are in clinical practice, is to feel comfortable with taking that science, that knowledge of technology, and how they incorporate it into clinical practice. So this will provide them that much needed insight. It'll be so illuminating to them as clinicians of how to intensify therapy, or in some cases, de-intensify therapy. It will increase that patient engagement in their own disease. I often say my goal is to turn patients into experts on their own disease. And so this new technology tool that gives you your present glycemia, that goes back in the past to tell you how you got to your destination, but also predicts the future. I really urge you to embrace this new science, to embrace this new technology. It'll equip you as well as your patients to have a life well lived, taking diabetes along for the ride. So understanding CGM, understanding this technology, it can be sometimes overwhelming. We all know its utility. We all have this great scientific background, but getting that knowing into doing has a few steps. One of the things that this clinician thinks is that all persons with diabetes can benefit from continuous glucose monitoring. It's not just merely glucose testing in a fancy way. This is really that retrospective, current, and prospective type of data that as you identify persons with diabetes, as you look at those individuals and think, what could they benefit from CGM? It's not just hypoglycemic protection. It's not just meant to be tagged along with those on insulin pumps or multiple daily injections. Even though I believe those people should all have continuous glucose monitoring, CGM does more than just telling you what your glucose is. It's an opportunity for patients to engage in their disease at a level that they've never had before. Maybe they don't know the effects of food. Maybe they don't know the effects of stress or sleep or occupation. In addition, maybe therapeutic adherence with their medication or all the different things they do in their life. It has a glycemic footprint, a signature. And so the first thing you should do in your practice is to look at that person in front of you and say, what do they need from me in management of their disease? So when you think of continuous glucose monitoring, you may put different reasons for CGM. You identify the person. You talk about how it may help illuminate their disease. Oftentimes you choose a CGM that might be easier to do. The very first CGM that is probably the low-hanging fruit is to do that blinded professional CGM. All of the different carriers and payers cover this. It's something you can start with that you know has the least amount of therapeutic inertia. You can provide them that data, bring them back in 2 to 3 weeks, make sure that they keep a narrative of what they do in their life. So that way you can overlay that ambulatory glucose profile, write their report, and be able to take their lifestyle, take their adherence, and to make meaning out of it. In addition, as a clinician, you can use that data to help make therapeutic decisions. Oftentimes, we don't need necessarily intensification, we need de-intensification. So it goes both ways in terms of advancing their therapy, because as we know, therapeutic inertia is massive. And so why not have a piece of technology that can fill in those gaps, that can really give us, how shall I say, that time that we're trying to get back from. Then from there, if you want to start identifying those people with personal CGM, the ones that need that real-time engagement ongoing as a part of their daily life, you can help them obtain that, oftentimes through pharmacy benefit or durable medical equipment. And then remember to empower them of how they know what their time in range is, what's their target, how to avoid hypoglycemia, how to do few tasks over time. You don't need to do it all in one sitting. It's really a journey. And so as you keep pace with them, I call them, you're their diabetes Sherpa, and you've given them this GPS for their life that they can see directionally. You can see a better engagement. And then as you go ongoing through this journey, bring them back in, download these things. Make sure and go put those softwares on the desktop. Make sure and identify a diabetes champion in your office to help share that workflow. Create a workflow. Don't just let time be the thing that pulls you back and forth. pause, take a moment, figure out how you're going to integrate this. How are you going to bring the patient in? How are you going to download the data? Where are you going to put it in the chart? How are you going to interface with your patients? Whether it's in person during the visit to review the AGP, or whether maybe you have them through a televisit. What an amazing way to virtually reach out to people for visits, but also have their glycemic data. And remember, you can bill for these. These are your time. But beyond just that, you're really giving the patient a tool to help personally manage their disease. And it's giving you a tool as a provider to go down and distill for them that interventional glycemic pathway that they have. And so it's really for both the patient as well as the provider. So I urge you to take the time to create that workflow, to identify those patients who could benefit from it, to utilize it in your practice to help guide your clinical decision making, as well as empower your patients for their own individualized journey.